Thanks, Caitlin, and thanks to everyone for having me here. I'm going to talk about a specific project. There's a lot of similarities to what we've heard from Anne, actually, and what we've heard from Mei-Ling, which is wonderful. The project is has a specific piece of a project, actually, that's ongoing. And it was about how we, as a health authority, so in Fraser Health, in collaboration with the right partners, which we see mostly as settlement organizations in our area, can do a better job of orienting newcomers to the healthcare system. So really helping them to both understand health services in our area theoretically, but also very importantly to know how to use them and to be able to use them in a way that is actually helpful for them and that they can access. So when I talk about orienting newcomers in this presentation, that's what I mean. It's about being very intentional and very active about how we help newcomers to understand the system so that they can use it. Oh, there we go. So just a bit of background about where I'm coming from. As Caitlin said, I'm with Fraser Health Authority, which serves a lot of the Lower Mainland, excluding the Vancouver area proper. So we're kind of Burnaby east to Hope. It's very large in terms of the population. It's a third of the province of BC's population living in our region, which is about 1.6 million people. It's also very large in terms of the staff. So there are 27,000 employees at Fraser Health. And as you can see from the map here, the red dots show where we have hospitals in the region. So there are 12 hospitals, as well as one major outpatient care facility in Surrey. And then there are also the public health units in each area, some home care services, some residential care services, and then mental health and substance use programs and services from Burnaby to Hope. So that's the region that we were focusing on for this project and that I work within. And I want to talk a little bit about diversity and migration in the Fraser Health region, and I'm sure that most of you are very well aware of this, and Caitlin has mentioned this. We are one of the fastest growing and most diverse regions in Canada, and this stat always blows my mind, but Surrey, for example, which is the largest city in our area, sees about 7,000 newcomers annually over the past 10 years or so. And we're also seeing what's being referred to as super diversity. So not only are there really large populations, for example, of South Asian people in some of our cities, but increasingly you're seeing people from all over the place. So the likelihood of taking two people randomly and the likelihood of them being from different backgrounds and speaking different languages is higher in a few cities in our region than almost anywhere else in Canada. And Fraser Health is fairly unique among health authorities in the area in that we have a department called Diversity Services that I work within. So I just want to mention that because in some ways that's a bit of an intervention and an attempt to do this work in and of itself. So our mission at Diversity Services is to really increase the capacity of Fraser Health for cultural competency, or we use the term diversity competency. It's a little bit broader, and cultural safety. So you can see here on the slide kind of what our goals are. And most of the ways that we try to do this work is, in large part, education of Fraser Health staff on issues related to caring for immigrant and refugee populations, also work on language services, some policy work that we're doing right now, and then special ad hoc projects based on need, which this project that I'll talk about today would fit into that category. And then in terms of the limitations of our capacity, the size of our department, we are basically two people that are full-time, and then we have a director and an admin support that are shared with ethics services at Fraser Health. So certainly in an organization of 27,000 people, it often feels like the capacity is much larger than what we can respond to and often feeling a bit stretched. So trying to find ways to work with partners and to prioritize to do the best job that we can. So why this project about how we can do a better job of orienting newcomers in the region? You've already heard about the need, and you all work in settlement, so I think you know very well about some of the challenges that newcomers come up against. The reason that we decided it was time to respond in Fraser is that it kept coming up to our attention in diversity services over the past couple of years. And a few of the venues that we heard about this need in were the Welcoming Communities project. Some of you probably know about those. Those are from several years back now. But there were a few Fraser Health sites that were looked at in that project, and it was clear that, as the report stated, many newcomers have incomplete knowledge of the healthcare system, including the roles of health professionals that were serving them and the services that are available. This has also been a topic at some of the local immigration partnership forums and some of the research that's been done for the local immigration partnerships in our area. We also have a project within Diversity Services. It's been ongoing for a few years the aim is to understand when patients are in our system. So for example, a patient is in a hospital. How do we as care providers do a better job of understanding their cultural beliefs and their values and responding to those and providing care in a way that's really respectful? So we were doing some community engagement, some focus groups and surveys to understand how to do that work a few years back. And what people were saying was, sure, we can tell you some ways to provide us good care when we're in the hospital, but we also want you to know we have a really hard time getting to your hospital sometimes, and we don't quite understand how the system works. So people talking about concern and frustration about not understanding basic system level processes and cultural norms in accessing health services. And as you can see in the graph here on the slide, when doing a survey with service providers, 85% of them reported that confusion around how the healthcare system works was a huge barrier for their clients, second only to language barriers. And service providers were also saying when we talked to them that many of them felt that they themselves had limitations in their understanding of the system. The system is very complex, services are always changing, and so it can be hard to keep up as a settlement worker, right, as a service provider. So they were looking for some support as well. So that's how this project got initiated. And in a nutshell, this is intended to be a pretty small project, but I think it points to a lot of issues that are much, much broader than this project and that will be worked on an ongoing basis. So we started with an environmental scan, and then we looked at using 3 data collection methods. And these were really, we weren't seeing this as a formal research project so much as having conversations with other stakeholders in our area about how we can work together and to start some relationship building and start some momentum to work on these issues. So we did interviews with service providers, small focus groups with service providers, and one with newcomers, and we were hoping to do more, but we kind of ran out of time and capacity, so hopefully some more of those will be forthcoming. And then we also did a survey that was online, and there were hard copies printed by some settlement organizations for their clients to fill out. And then there was a final report that was distributed in the fall, but as I mentioned, this work will be ongoing for quite a while. So in total, we heard from 50 service providers and 42 newcomers. And just in terms of the key pieces that made this project possible, we had a Master's in Public Health Practicum student from SFU that did most of this work. So as I mentioned, capacity can be a challenge in our department, so we're always looking for extra support. And I think Pinathy, who did the work, is listening in online, so I just want to say hello and a big thank you to her. And then also we worked with several settlement organizations. They did a lot of the recruiting for the project, spreading the word amongst their colleagues, and of course were the ones that shared the insight and gave us all the information. And so really a project wouldn't have been possible without them. So what did people say? And this is really important, but I think it's also it's things that you in the room know very well, right? It's the issues that you come up against all the time and that you see your clients trying to deal with. So I won't read the quotes, but I will pause for a second so you can read them. I hope they're clear enough. So the quotes that I've included on this page are the ones that we saw as kind of directly relevant to the goal of the project, which was around orienting newcomers to the healthcare system. So people talked about difficulty finding information, right? A lot of information was online, they said, on the website, which is hard to navigate, which is in English, and which is text dense, which of course can be challenging. They had difficulty understanding services to be able to use them. We often heard about vaccinations, not understanding what that was all about, around processes that others have talked about, right? Understanding the difference between going to an emergency room versus a walk-in clinic versus how do I get to a specialist and when. And certainly a lack of clarity, as others have already mentioned, around payment and billing, right? So what MSP covers and why you might get a bill from Fraser Health and what do you even do with this bill once you get it, especially if the bill is in English. And then, of course, a good reminder, I think, in the last quote on the page, that newcomers, if they're having challenges understanding and navigating the services, it's not for any lack of willingness on their part to try to do that work. It's not for any lack of attempt. It's that systems are very confusing. And we feel this and kind of shake our heads at it all the time in our department. We'll often be out in the community and we'll get a question about, I'm looking for mental health services for my 16-year-old daughter, or I'm a South Asian senior and I'm wondering about home care services. Where can I go? And my answer is usually, I'll have to look into that. I don't know off the top of my head, and I'll go back and do research. And it's not always very easy to find out, even for someone like me who works within the healthcare system and has pretty easy access to that information. So certainly, we understand that systems are complex. The slides that are included here are things that people told us that weren't necessarily directly related to the goal of the project, which was understanding how to orient newcomers. But it's so important, and so I want to spend some time talking about it. It was about how available and welcoming services are or often are not in our region once people are finally able to make it to those services. And as someone mentioned, again, I'll highlight the last quote, that in some ways it doesn't really matter how well you orient newcomers to the services if once they finally get there, they're not usable, right? So people talked about barriers, language barriers, as we've already heard about, really often a lack of respectful treatment and positive relationships with Fraser Health employees. Fraser Health employees having a lack of knowledge about available resources to support patients and a lack of understanding about insurance, especially interim federal health insurance, as Mei Ling has talked about. And it really is true that sometimes patients told us about being turned away from our services because people didn't understand the insurance they had or couldn't figure out or didn't want to figure out how to deal with language barriers and how to address those. So painful to hear about, but important to talk about. And now I'll get into some of the recommendations that people gave us during the project. And I've highlighted two that I will show on the next two slides as key recommendations. Those are only, I'm calling them key because they're important, they're relevant to the topic of orienting newcomers, not that they're kind of inherently more important than anything else anyone said, and I'll talk more about that later. So the first piece that people talked about Fraser could do to help educate newcomers about the healthcare system is to offer education sessions and really create more opportunities for Fraser Health employees to build positive relationships with newcomers. So education sessions, Fraser Health holding education sessions themselves and or participating in education sessions that settlement organizations are already providing. As well as Fraser Health participating in informal events. So finding ways to get out in the community, to meet people, to talk informally about health services, and to build kind of positive relationships and help build up some of that trust that often might be lacking for people coming to our region. Really important. And I also want to note that some settlement organizations also recommended that Fraser Health should not do education sessions, which is a really important message to hear as well, right? So they talked about Fraser Health not having the relationships and not having the trust with newcomers, and that's something that's better left to settlement organizations and that we can support. So again, another really important perspective. Another recommendation that's directly related to orienting newcomers in our region was for Fraser Health to develop an information brochure talking about the services available in our region, but getting away from online, so having something that's available in print, that's not complex, that's in plain language, so easier to access for people with low literacy, and that's translated into a multitude of languages. And now I want to talk about some of the recommendations that are not as relevant, again, to the topic of orienting newcomers to the healthcare system, but that are more about the availability of the service and the safety and accessibility of the services. So, of course, expanding and enhancing language services, we've heard about that. Educating healthcare workers about patients' needs and services and helping them to build and understand, build respectful and compassionate services. Improving availability of mental health services for newcomers, we hear about this all the time. Promoting access to family doctors, of course, because they're often the gateway into other health services in the area. To consider and consult with newcomers when developing policy. And striving for equitable access to health services for newcomers. That one's, it's kind of included in there as just a bullet in the list, but it's huge, right? This is an enormous piece of work and an enormous commitment. And then, of course, to collaborate with settlement organizations to keep building relationships and especially an awareness of what services we each provide and how we can better link newcomers back and forth. And the last is to conduct further research. Because internally at Fraser Health, we often don't have a good sense of how our services are being received and who we are keeping out of services unintentionally, right? We don't have a lot of stats on the background of people, the languages that people speak who are using our services, and so doing a better job of recognizing who is using services and what their health outcomes are. So what's next? Some of these pieces are pretty tangible and kind of short-term pieces, and a lot are very much bigger picture pieces that we'll be working on for quite a while. But we have started working on some resource and education session development, so developing that brochure that we've talked about, as well as developing some education sessions. And I want to mention that we have secured some of the resources from Anne's program that she talked about, some of the fact sheets and videos, and are hoping to use those in the sessions because they really are wonderful tools. Also, to continue educating Fraser Health employees and medical staff. So we have some ongoing training that we'll continue to provide, as well as there's a new training this spring on caring for clients who are refugees, offered with them through Diversity Community Resources, and that will include a piece on IFH as well to hopefully help healthcare providers to have a better sense of what that is and how to use it in a way that's really helpful. Ongoing improvement of language services, so continuing to make sure that staff know about the service, how to use interpreting services. Also some policy on language services. Right now in Fraser Health, as in most health authorities in the region, there isn't a policy that clearly outlines what our commitment is to providing interpreting services and what patients who don't speak English are entitled to. So we're working on that piece this year at Fraser Health, as well as a larger piece, we're calling it kind of the diversity policy for short, but on what is Fraser Health's commitment to respectfully responding to kind of quote unquote diverse clients, and what is our commitment to health equity within the region. Also, there's an ongoing search all the time for strategies and for capacity to be able to do more outreach. Currently, even though Fraser Health has so many employees, there are very, very few roles that have the capacity to kind of get out of their unit, their public health unit or the hospital, and to do some outreach in the community, to go to health fairs or to come give a talk at a community session. And so trying to find ways to do this, possibly a cross-cultural health broker program, as others have talked about, which could be really exciting, possibly just the development of some new roles or expansion of the scope of some roles. And then further information gathering and feedback and continued invitations and relationship building back and forth between folks at Fraser Health and in settlement organizations in our area. So I've gone through those really quickly, but I'm totally happy to talk more about them during the question and answer phase or by email. I'll give it at the end. And I just really want to highlight that I think for all of these pieces, it is so important that we have direction and feedback from immigrant serving organizations. And the image I've included here, it might seem like kind of a funny choice for this presentation, but to me it really symbolizes partners working together, but kind of supporting and pushing along in some ways in the right direction and keeping us accountable, right, which I really see as an important role for settlement organizations. And lastly, I really want to highlight this piece. It's so important, and I know that for a small, this was intended to be a fairly small project, and I know that for a small project, it can be hard as a service provider in settlement, for example, to kind of get motivated and to want to participate. And it feels like some of these issues that we're talking about, they're not new, they're not going to be solved by a small project, they're large systematic issues. But I just really think it makes a difference to be connected and to have these conversations. And so the obvious benefits are in working with settlement organizations is that you guys have the trust and the connection to newcomers that enabled us to hear from them, hear their stories. And you have connection to each other, so you help spread the word. And you also have all the knowledge and experience that, that gives us the insight into what we need to do differently. We also hear drastically different things from talking to folks in settlement than when we talk amongst ourselves in the health authority. So an example I'll give here is when I first started in my role, almost 2 years ago, I did a survey internally at Fraser Health to get a sense of how we thought we were doing with language services. And so, depending on the question, 82 to 89% of respondents within Fraser Health said that they were pretty happy or they were neutral about language services. So we thought, well, that looks like we're doing a pretty good job. Things are going pretty well, right? And of course, the story is pretty drastically different when we talk to people in settlement and we talk to newcomers. So for example, in this project, in the survey portion, 55% of newcomers and service providers said actually language barriers are the biggest issue that we face. It's the biggest problem in accessing services at Fraser Health. And so that's just really important that we hear that different message and that you help to remind us of our shortcomings, which is really important. And I've included the happy face there. It maybe should be a sad face because it's shortcomings, but I'm just trying to highlight that we are appreciative of that and that it's really important for us to hear that. So I just want to really express our gratitude and humility and ask that you, as settlement organizations and service providers, stay involved and keep supporting us and pushing us along in the right direction and hold us accountable. That's just so critical. So here's a list of organizations, and many of you are here today or online, that took part in this project and that we're hoping will continue to stay involved. So just a huge thank you to everyone in that project. And that's it for me. We're happy to talk and answer questions right away after this.